over the longer-term advantages of prudent self-constraint response prevention. Change that last. Several studies suggest that cognitive behavioral therapy can work in the long term. A study that evaluated people who had been treated with cognitive behavioral therapy for social anxiety found that even 3 years later, they were able to use what they had learned in cognitive behavioral therapy to more effectively cope with anxiety. Cognitive behavioral therapy may improve outcomes for anxiety-related disorders compared with control conditions up to 1 year after treatment completion, according to results of a systematic review and meta-analysis published in the Journal of the American Medical Association Psychiatry. Beyond 1 year, effects vary by specific disorder, researchers noted. Quote, "The results of this meta-analysis suggest that, on average, cognitive behavioral therapy was associated with moderate symptom reduction in anxiety disorders, post-traumatic stress disorder, and obsessive-compulsive disorder until 12 months after treatment completion. A highly effective psychotherapy called cognitive behavioral therapy, CBT, focuses on how our thoughts, beliefs, and attitudes can affect our feelings and behavior. Traditional cognitive behavioral therapy treatment usually requires weekly 30 to 60-minute sessions over 12 to 20 weeks. A faster option now emerging is intensive cognitive behavioral therapy, or known as ICBT, which employs much longer sessions concentrated into a month, week, or weekend, or sometimes even a single 8-hour session. So traditional CBT helps people learn tools to reframe different types of thinking, such as black and white thinking, I can't do anything right, and emotional reasoning, I feel you dislike me, so it must be true, and other potentially harmful thought patterns that fuel mental health problems and undermine relationships, work, and daily life. Once learned, the coping strategies taught during traditional CBT or ICBT sessions can help people deal with a variety of problems throughout life. So can intensive cognitive behavioral therapy help people with OCD and anxiety disorders? Intensive cognitive behavioral therapy has been used to treat many people suffering from mood and anxiety disorders, trauma-related disorders, and other issues. There are intensive cognitive behavioral therapy programs that focus in specific areas such as anxiety disorders, including agoraphobia, generalized anxiety disorder, social anxiety, specific phobias, panic attacks and panic disorder, separation anxiety, and yes, obsessive compulsive disorder, OCD. So is intensive cognitive behavioral therapy effective? Research on effectiveness, or whether or not intensive cognitive behavioral therapy works, is relatively new, but studies suggest it is effective for treating OCD. Children and adults who have this condition make similar long-lasting gains with traditional or intensive cognitive behavioral therapy. It's also effective for treating panic disorder in teens, anxiety symptoms in children with mild autism spectrum disorder, and severe mood disorders. Additionally, fewer people drop out of treatment with intensive cognitive behavioral therapy compared with traditional cognitive behavioral therapy. So who might benefit from the short time span from intensive cognitive behavioral therapy? People with full-time jobs who find it difficult to take time off during the work week for weekly appointments might be able to commit to a weekend of intensive treatment. Teenagers busy with academics and activities during the school year may benefit from intensive sessions for a week during the summer. Families juggling multiple schedules can benefit from intensive cognitive behavioral therapy because it allows them to focus on treatment without feeling their time is split among several other commitments. And people who live in areas without easy access to mental health services or specialists may be able to travel for a weekend for intensive treatment. Intensive cognitive behavioral therapy may also help people who've tried traditional cognitive behavioral therapy but have not found it feasible or successful. Alternatively, intensive cognitive behavioral therapy sessions may introduce people to this form of psychotherapy and its benefits, thus serving as a catalyst for traditional cognitive behavioral therapy treatment. So what are the drawbacks to using intensive cognitive behavioral therapy? Well, most importantly, the effectiveness of intensive cognitive behavioral therapy is still being evaluated. Intensive treatment requires specialized therapists who are trained to deliver intensive cognitive behavioral therapy. It may not be possible to find a well-qualified program or therapist nearby, which could add to the cost and time commitment of treatment. Unfortunately, most insurance companies do not cover intensive treatment programs, such as intensive cognitive behavioral therapy, so it can be very expensive. But what if there was a better way? What if there was a treatment plan that was intensive, or could be, evidence-based, proven to work, convenient, and not too expensive? Would you do it? What if you could beat OCD in just 90 days? You can, according to the research on intensive cognitive behavioral therapy and neuroplasticity. I am offering you this 90-day treatment plan